Meeting of the committee will come to order. We have pending an amendment in the nature of a substitute, a manager's amendment, and the first amendment would come from the Republican side. Stupid thing.
Mr. Chairman, Republicans are locked, cocked, and ready to rock, and we think our first amendment should be Dr. Burgess of Flower Mound, Texas.
Mr. Burgess, you have an amendment at the desk?
Mr. Chairman, I have an amendment at the desk.
And has that amendment been available for at the minimum 2 hours?
That amendment has been ready for 3 weeks.
Mr. Chairman, could I reserve a point of order?
Mr. Pallone reserves a point of order. The clerk will report the Burgess amendment.
It's Burgess 40.
Amendment offered by Mr. Burgess, add at the end of the following new division, Division D, Medical Justice.
Without objection, the amendment will be considered as read. Mr. Pallone, gentleman from New Jersey, reserves a point of order. The clerk will distribute the amendment, and I will recognize Mr. Burgess to speak on his amendment.
Thank you, Mr. Chairman. You know, today, so many doctors across our country are forced to practice what's known as defensive medicine. They face the constant threat of lawsuits and unsustainable medical liability insurance rates, and that results in millions of dollars of unnecessary tests and procedures. Seasoned medical professionals are retiring early because staying in practice is no longer financially feasible, further contributing to our nation's doctor shortage. This is a growing crisis, and it's pushing affordable health care beyond the grasp of millions of Americans. And my amendment is fairly straightforward. A national across-the-board change, just like the medical justice system that we have in Texas, would lower costs and improve care by lessening the threat of overactive trial attorneys and unmerited lawsuits that they often bring about. In Texas, we passed successful legislation which has controlled the explosion of medical liability suits and brought things back to earth. It caps non-economic damages at $250,000 for the doctor, $250,000 for the hospital, $250,000 for a second hospital or a nursing home if one is involved, for a total aggregate cap of $750,000. There's a cap on wrongful death awards at $1.4 million. Expert opinions related to physicians may only be provided by actively practicing physicians. And I cannot overemphasize how important this point is. At virtually every meeting, town meeting, which I have with doctors, and I've done many across the country this past year, one of the main complaints is that The plaintiff side can produce a hired gun from outside of the community who perhaps is no longer even in active practice or the type of practice where the question of the lawsuit has been given, and will offer testimony in support of the plaintiff, always for cash. Payment of future damages should be on a periodic or accrual basis, and limitations on liability for Good Samaritans providing emergency health care. I'll never forget, shortly after Hurricane Katrina, many people fled the Louisiana-Mississippi Gulf Coast and came to the Dallas-Fort Worth Metroplex. We had retired doctors who either couldn't come down to the various centers that were set up, they either couldn't come down and help for fear that they would expose themselves to liability, or they did it anyway, putting themselves in significant financial peril, all to help their fellow man at a time of a national medical crisis. Lawsuit reform in Texas has created a magnet for doctors to come to our state and has provided the funding mechanism to improve access to care and enhance patient safety through significant liability savings. In 2003, when Texas passed the sweeping medical liability reform, the results have been better than expected. Recent results posted by the Texas Medical Association show that charity care rendered by Texas hospitals rose 24% in the 3 years following these reforms. Texas has licensed nearly 15,000 new physicians in the 5 years since reform, at a 36% increase from pre-reform days. 33 rural counties have seen a net gain in their emergency room doctors, including 26 counties that previously had no emergency room doctor now have an ER doctor because of this reform. After years of decline, the ranks of medical specialists are growing again in Texas, and what's important to me in my field of obstetrics, we saw a net loss of 14 obstetricians in the 2 years preceding reform. Since then, the state has experienced a net gain of almost 200 obstetricians. 26 rural counties have added an obstetrician, including 10 counties that have previously had none. Now, a vote against this amendment will indeed fulfill the commitment to the American Trial Lawyers Association that perhaps has contributed to some of our campaigns over the years. So instead of making it easier for doctors to practice medicine, we're going to make it, vote against this amendment will make it easier for attorneys to file lawsuits. A vote for this amendment will tell American doctors that we're committed to putting in place reforms that will allow them to do their job free of that government or special interest intervention. A vote for this amendment will tell America's patients that access to high-quality, affordable health care is not just a campaign slogan, it is in fact our goal. I'll yield back the balance of my time.
Gentleman yields back the balance of his time. Who seeks recognition? Mr. Pallone.
Thank you, Mr. Chairman. I'm going to insist on my point of order without reference to the, to how I personally feel about the amendment. The amendment contains provisions, obviously, on malpractice, such as caps on damages and jury instructions. And these are not sufficiently tied to health care policy. In other words, they fall outside of our jurisdiction. They're basically within the scope of the Judiciary Committee, and therefore outside the scope of the bill's referral under Rule 10. I know that the gentleman feels very strongly about this, and this is certainly something that has been debated in the media and with the President, but it doesn't fall within this committee's jurisdiction, and therefore I insist on the point of order.
Gentleman asserts his point of order.
Mr. Chairman?
Oh, sorry.
Mr. Barton, point of order.
I want to oppose Mr. Pallone's interpretation on the point of order, and you can correct me, Mr. Chairman, if I'm wrong, but I believe this committee in past Congresses has passed liability reform measures at the full committee level that included certainly the subject issues in Dr. Burgess's amendment, and in some cases some of the specifics. So I don't know why, if it was in order in past Congresses, it wouldn't be in order in this Congress. There are certainly things in the bill within the jurisdiction of the committee, and there are things in the manager's amendment in the nature of the substitute that are clearly in the jurisdiction of the Ways and Means Committee, but they're in the committee amendment in the nature of a substitute that we're considering. So I would respectfully urge you to rule against the point of order, and you may vote against his amendment, but at least allow it to be voted on.
Further discussion of the point of order.
With the
Mr.
ranking
Burgess.
rule for,
I'll yield to my, if I have the time, it may be
Well,
the
I'll
chairman's
recognize
time.
Mr. Burgess on the point
if
of
I
order.
could, just bringing up that under Rule 10, this committee has jurisdiction over regulation of all insurance companies, and certainly we have the regulation of interstate commerce is within our jurisdiction. I don't think anyone would want to make the argument that it's not. Two other committees in the past 24 hours have made similar legislation to this within their jurisdiction, when clearly it falls more into the jurisdiction of this committee than in Education, Workforce, and Ways and Means. So I would just make the point that this is germane to our committee. This is within our committee's jurisdiction. It's an extremely important point. Again, if you feel that you just have to vote against the amendment, then that's your conscience. But I think the striking this down on technicality really it will limit the future ability to discuss things in this committee, and even more to the point, I think it just sends the wrong message to the people that we're trying to help in this with this legislation, which is America's doctors and America's patients. Now you'll back.
Mr. Chairman.
Who else seeks recognition? Mr. Stearns.
Mr. Chairman, I'd like to follow up on Ranking Member Barton's point that if indeed I, as a member here, have voted on liability reform on this committee, I guess the question for you is, Mr. Chairman, isn't that true that we have voted on liability reform in this full committee? Isn't that true?
I do recall it, yes.
So if Mr. Barton's point is true and you've confirmed that we voted on it, then why would not we vote on it again? What's the point? Mr. Pallone's comment, I don't think, is germane on the germaneness.
Okay. Who else seeks recognition on the
Chairman?
point of order? Mr. Boyer.
Mr. Chairman, I would encourage you that this is a moment in time for us to address the issue. The President has embraced a cause under the American people to say that he seeks to lower cost and increase quality. That is his cause. To leave medical liability reform out of that denominator is a huge error on our part. So I would encourage you, Mr. Chairman, that this committee has had jurisdiction on this issue. If other committees want to work with you once we pass this out, I think that's very pertinent. Indiana has the oldest system on medical liability in the country, and the state legislature back in 1975, we capped medical malpractice. That cap has been raised twice, but it is a system that works. The states contiguous to Indiana have very high medical malpractice premiums, and their doctors are struggling. And this is a moment in time in our country that if we're going to address this on a national basis, Mr. Chairman, I think it is very appropriate that we allow the gentleman's amendment to be heard and for there to be thorough discussion. And I would urge the chairman to make this amendment in order. Yield back.
The chair is ready to rule, but the gentleman from Georgia wishes to speak. I'd like you to speak on the point of order.
On the point of order,
yes.
Mr. Chairman, and since I don't know what you're about to rule, I feel compelled to add my 2 cents in this too. It's estimated on the low end that liability reform, fair liability reform, could save the healthcare system $70 billion a year. And when we had the director of the CBO in here saying that this bill will not bend the growth curve of the expense of health care in the right direction, and then he testifies before the Senate Budget Committee to Senator Conrad and says the same thing, I would think that our committee would be looking for every possible way to rebend that growth curve, and this would certainly go a long way toward that. And I yield back, and I encourage his amendment.
Thank you very much. The chair is ready to rule. We have inquired of the parliamentarian, and notwithstanding the merits for or against this amendment, we have to follow the rules. And we asked the parliamentarian whether this amendment would be germane to the pending matter. And the parliamentarian has told us that because the amendment legislates in the area that's solely within the jurisdiction of the Judiciary Committee, when it refers to jury instructions or defines negligence or deals with the question of damages, that the amendment offered by the gentleman from Texas is not germane to the bill. Now, perhaps the amendment can be rewritten in a way that it would be germane to the bill, but this amendment that has been offered is not germane, and therefore the chair has to rule under the rules that it is not in order.